can be. This outbreak has been spreading. There are almost 300 cases already, overwhelmingly in Brooklyn. And to give you a sense of what a troubling development this is, it's a huge spike. We saw only 2 cases in New York City in 2017. So we have a very serious situation on our hands. We cannot allow this dangerous disease to make a comeback here in New York City. We have to stop it now. Today, we are declaring a public health emergency effective immediately. This will mandate vaccines for people living in the affected area. Department of Health will issue violations and fines to people who remain unvaccinated. The only way to stop this outbreak is to ensure that those who have not been vaccinated get the vaccine. It's crucial for people to understand the measles vaccine works. It is safe, it is effective, it is time-tested. I want to thank the folks who every day go out into our communities to reach out to everyday New Yorkers, to let them know both about the dangers they face, but also how they can protect themselves and their families. Our health department employees here behind me, thank you all for the work you do, the outreach you do. We appreciate you, and we're going to need your help in these next days to stop this outbreak. We have to take this seriously. Every one of us has to feel responsibility for the situation because measles is so contagious, can spread so quickly. And the outbreak could, in fact, especially spread because soon it will be Pesach. There'll be school vacation. There'll be more and more families together. The last thing we want to see is more family members afflicted by this disease. So we're taking urgent steps right now to make sure that we can stop this. You'll hear the details from Doctors Blasio and Barbeau. But I want everyone to understand this is a blanket order for the Williamsburg neighborhood. And specifically, we're making clear that unvaccinated students will not be allowed in schools or daycares. The order makes very clear the ability of the health department to issue violations. And I want to be clear, it is not our hope or our goal to issue a violation. We want to simply solve the problem. We have the ability to issue violations, but whenever people comply promptly, we will not have to, or we will not have to levy fines. The goal here is to send the message that people need to act immediately to get vaccinated, and that vaccination is available readily here in the neighborhood and throughout the city. I want to emphasize, our public health system stands ready to help any New Yorker who needs the vaccine for themselves or their child. If they have insurance, it will be covered. If they don't have insurance, they will only have to pay that which they can pay. If they can't afford anything, it will be given to them for free. So there's no financial reason not to get this vaccine. Schools that do not actively participate in helping us address this issue and do not exclude unvaccinated children, if they persist in allowing this danger to continue, we have the option of closing them for a period of time until this crisis has passed. Again, that is not a tool we want to use, but it is one we will use if we have no choice. We don't take any of these steps lightly. It's an unusual action for us to take, but it is entirely related to both the danger of the disease and how highly contagious it is. This is a disease that can spread just in a few hours. Once someone is infected, it can spread and be visible very, very quickly. And the results can be devastating. For those that live, there can be brain damage, but it's also important to understand that measles is not a disease to dismiss. Measles can be fatal. And this is true for children, but it's also true for other members of our community. Pregnant women can be endangered. Folks going through medical treatment, such as chemotherapy, can be endangered. Senior citizens can be endangered. This is a broader danger to our community. Anyone who wants to get the vaccine can get it through a simple call to 311. and they will be connected. And this is a simple action you can take to protect your family and your community. We are trying to get people vaccinated. Our goal is not to fine anyone. Our goal is not to shut down schools. Our goal is to get people vaccinated. But we're also trying to help everyone understand there is urgency here. Every hour, every day matters here. So we have the tools available now because of this emergency order to fine and fine very substantially. But if people would just go and get vaccinated, there's no cause for a fine. That's the message today. Go ahead on the specifics.
So within this, we are going to be identifying individuals within the context of contact tracing, meaning that when someone gets sick, we want to identify anybody who's come in contact with them who could potentially be at risk. If in those situations they're found to be exposed and unvaccinated, we will do anything and everything possible to help them get vaccinated within the designated 3 days, because that's the window within which they can then use that vaccine as protection against the measles vaccine. There may measles disease, yes. There may also be situations where they may be immune globulin, and we can help them do that. So again, I want to just reemphasize the point that the mayor made. The point here is not to fine people, but to make it easier for them to get vaccinated.
You know, the number of measles cases has more than doubled since February. Is the Department of Health aware of any particular day or event in which there was a large-scale exposure, or is it just sort of been trickling in?
So we are not aware of particular events, but as Dr. Blasio mentioned, we are concerned about families having measles parties. And so I think it's important to emphasize the fact that, you know, back in the day, people were having parties to expose their kids to chickenpox, to measles, and we live in a different world now. There are many more individuals who are living with chronic diseases, who are surviving cancer, and so we don't want children or adults to be unnecessarily exposed to measles, because there are serious consequences to that. And the easiest thing to make sure that your children are protected against measles is to get the vaccine.